Hello, ladies. We're going to be doing our slides for chapter 26. I'm only going to do slides 1 through, I think it's 30. Let's look. 36 today. I'm splitting them in two because there's so many, and I just think that sometimes it can be information overload, so I decided that we'd split them up. So you're only going to get half today. So let me share my screen with you guys, so that we can begin to see these lovely slides. Okay, here we go. Chapter 26, Medicine. I'll let that load for just 1 second. The medicine section includes codes 90281 through 99607 and is used for coding diagnostic and therapeutic services that are generally non-invasive. Some invasive procedures such as cardiac catheterization and percutaneous thrombectomy are included in this section. The various subsections contain many specific notes to be used with certain groups of codes. These notes are important for coders to read so that they can code services appropriately. The subsections cover a wide variety of services and many specialized diagnostic tests, such as audiologic function tests, electrocardiograms, and biofeedback. The codes in the medicine section usually do not include the supplies used in testing, therapy, or diagnostic treatment unless specifically stated in the code description. Immunizations. Active immunization is given when it is anticipated that the person will be in contact with the disease. Passive immunizations does not include, let me do that again. Passive immunization does not cause an immune response. What happens instead? Injected material, i.e. the immunoglobulins, contains a high level of antibody against a disease. Correct coding includes supply injected and administration of the injection. Active immunizations can be toxoids or vaccines. Toxoids are bacteria that have been made non-toxic. Vaccines are viruses that are given in small doses and cause an immune response. Bacteria that causes disease may be made non-toxic or toxoid, and it's injected to build immunity. Yes, I know I read that twice, but I just want you to make sure that you understand the difference between a non-toxoid and a toxoid, and vaccines, and what they're actually used for. I know that lots of us may have personal opinions about vaccines, but I do not give my personal opinion on vaccines. I think that is just something that everybody decides for themselves. Okay, passive immunization does not cause an immune response, contains antibodies against certain diseases, and they're called immune globulins. I always call them goblins. Immune globulins. Name a disease for which passive immunizations is used. I'm going to give you a couple. Rabies, hepatitis B, or tetanus. I can remember being a little girl and stepping on a rusty nail and having to have a tetanus shot. I think that was one of the most painful things. It wasn't the actual stepping on the nail, it was the actual shot. Okay, we're going to continue on with immune globulins. The immunoglobulin section is relatively new to the CPT manual. The codes in the subsections report only the immunoglobulin product and must be reported in addition to the appropriate administration code from the appropriate subsection. Okay, I want to make a point. I keep saying it when I'm reading it, but I want to just tell you. Usually, almost always, when you're doing an immunization, you're going to have two codes. The immunization that you're actually giving, and the route of administration. I'm going to talk a little bit more about immune globulins, 90281 through 90399. So, codes in this subsection are divided by the type of immune globulin, method of injection, and type of dose. So the type, for example, would be rabies or hepatitis B. The method would be intramuscular, intravenous, or subcutaneous, and the dose could be full dose or a mini dose. Codes in the immunization administration subsection are reported with the code for the substance given. And what I'm reading is a little more, it's more words than what the slide has, but I'm just trying to give you a full sentence in a lot of these situations. I'm not just reading the actual slide. Okay, so 90460, 90461 are patients through age 18 when the physician counsels regarding an immunization. 90471 through 90474 are patients 19 years of age or over. Patients of all ages, including under 19, if the physician does not counsel regarding immunization. 90471 and your add-on code 90472, percutaneous, intradermal, subcutaneous, or intramuscular injection. 90473 and your add-on code 90474, oral or intranasal. Immunization administration codes are divided by the age, the patient's age, and the administration method. Make sure you code for each injection that is administered. Be careful when a combination immunization, for example, DTP, is given. This is all combined in one injection, even though there are 3 immunizations. They are all given in one injection, so only one administration code is used. So I don't know how many times you guys have maybe gone into a physician's office and all that your child needed was their immunizations. So you make an immunization appointment, and when you get there, they go straight back. The nurse gives them the immunizations. You wait for 10 minutes to make sure nothing happens, and they let you go home. The doctor did not counsel on those immunizations. So that's what they're talking about, counseling regarding the immunizations. I hope that example helps. Okay, administration codes are divided according to the method of administration and some by age of patient. You must read the descriptions carefully. Your methods can be percutaneous, which is intradermal, subcutaneous or intramuscular, intranasal, which, you know, they do up their nose, or oral. And if you look at the little diagram at the bottom, it's going to tell you the difference in intramuscular, subcutaneous, and intramuscular. Each administered dose must be reported. For example, multiple injections can be reported for a patient over age 8 by using 90471 for the first injection and 90472 for each injection thereafter. Now let's look at our examples. So if they have a tetanus, 90471, then 90472 rubella add-on code, then 90472 diphtheria add-on code. Now we're just talking about the administration codes. See, they had a tetanus, and then they had two more. So you're going to use 90472, 90472, or you could use 90472 times 2. That's going to depend on your payer. For testing purposes, you guys can use, or even in your workbook or your step-by-step manual, you can use times 2, times 3, times 4, and so on and so forth, instead of writing out those codes every single time. So remember, you had the tetanus, that's 1, so 90471, that's your tetanus. Then you had a rubella, that's 90472, and you had a diphtheria, another 90472. So you would do 90472 times 2. Rubella and diphtheria are your 2. I hope that you guys understand that. If not, let me know and we'll go back over that again. Okay. The vaccines toxoid subsection lists vaccine products given in immunizations. Coders must carefully review the description of the vaccine product code to determine which disease is specified. When is the combination code used? When one code is available to describe multiple products given. Be careful to select the correct code. For example, there are 8 combination codes for diphtheria. So if you look at code 90700, diphtheria, tetanus, and acellular pertussis, that's the DTaP, but it has the small a. You have a poliovirus vaccine that's inactivated, which is 90713 is the IPV. And then if you look at 90658, the trivalent influenza virus vaccine is a split virus, 0.5 milligram dosage. Now, as you're coding and you're reading your scenarios and you're looking in your CPT, you're going to be able to really study on those particular codes. Some vaccines are given on a schedule. For example, 90633, 2-dose hepatitis A vaccine, first dose, first visit, second dose, second visit. 90633 is reported for each visit. Each time the vaccine is administered, the code is reported along with the date the injection was given. That's some of your billing information there. And well, it's coding too, but when you're billing, you have to watch out for those things. You do not assign modifier 51 with vaccine toxoid codes. Rather, depending on the payer, list each code multiple times or use the time symbol to indicate the number. Modifier 51 should not be reported for vaccine toxoids when performed with these administration codes, 90460 through 90474. How are you ever going to remember that? You guys have to pay attention to your rules and regulations that you have before each subsection. Okay, important reporting rules. If vaccine administered during an office visit not related to the E&M, you report the E&M service with the modifier 25 plus your vaccine plus your administration. And a lot of those things depends on your local carrier. Office visit for vaccine only, code only the vaccine, no E&M, evaluation and management service, and it depends on the local carrier. So you're thinking, okay, well, how am I supposed to know that when I get to my facility? Guys, there's always going to be in-house training. They're going to tell you what they expect from each scenario. So what we're learning is a real large world view of it. So I don't want you to worry too much about, oh my goodness, well, how I'm going to know this? Well, when you get to your facility as a coder, you'll receive coding training specifically for third-party payers and what that facility expects. Oh, sorry. I went too far back. Let me see if I can get us back where we need to go. Okay. Influenza and pneumococcal. These two vaccinations are commonly provided. So we're going to talk about what trivalent means. It means 3 viruses. This word down here, trivalent, trivalent, sorry, means 3 viruses, because tri means 3. Third-party payer may require CPT codes or CPT codes with HCPCS codes for the service. For Medicare patients, the coder reports only the administration code for an immunization if no E&M service is reported. E&M office visits include the administration of the immunization. So now we're going to move into psychiatry. Psychiatry 90785 through 90899. The psychiatry section has a lengthy note under the heading that details the use of psychiatric codes in conjunction with hospital and clinic E&M services. If psychiatric treatments are rendered on the same day as the E&M service, both are reported with one code from the psychiatry section. If these treatments are provided on a different day from the E&M service, a code from the E&M section is listed. Some codes reflect evaluation or diagnostic services. Some reflect therapeutic procedures, and some reflect psychological testing. Time is a major billing factor. Codes are divided on time. Medical record indicates the session time. If you're coding for psychiatry, you must know your time. And if they don't have it listed on the medical record, you must query the physician. So, when selecting a psychotherapy code, ask these questions. How much face-to-face time was spent with the patient? Does documentation support an evaluation and management code in addition to psychotherapy? If rendering psychotherapy is the approximate time of the psychotherapy noted in the medical record. So those are 3 great questions you can ask yourself. You can put this in, there should be in the CPT section under psychotherapy or psychiatry, there should be a page there for you to make notes, and you can actually write these questions on there. Okay, psychiatry 90785 through 90899. Many services provided in partial hospital settings. Patient in the hospital during the day but returns to home for evenings and weekends. Interactive psychotherapy is typically furnished to children. It uses play equipment, physical aids, nonverbal communications, and other mechanisms of communication. So now we're going to talk about biofeedback, 90901, 90911. So biofeedback is a process by which individuals can monitor or manage psychological processes that are normally out of their control. It's used to help patients gain control over bodily processes, for example, high blood pressure or chronic pain. Medicare coverage issues Manual 35 through 27 restricts the use of biofeedback. Medicare does not cover biofeedback for psychosomatic disorders. Psychosomatic disorders. Oh, sorry guys, I went too far. Sorry about that. When biofeedback is part of an individual's psychophysiological therapy, codes are listed for both the biofeedback and the individual psychophysiological therapy. So now we're going to talk about dialysis. I think this is something that you may not know a lot about, but everybody has heard of dialysis. So what is the specific purpose of dialysis? It removes waste products from the body when the kidneys, cannot perform the function adequately. Okay, so it cleanses blood, and temporary is non-ESRD, which is end-stage renal disease, permanent end-stage renal disease. Two parts of the report: end-stage renal disease dialysis service is physician service, and the hemodialysis procedure. And here's a picture of a dialysis machine. I tell you, I feel like my mouth isn't working today. End-stage renal disease services 90951 through 90970 include establishment of dialysis cycle, physician services, E&M outpatient dialysis visits, and patient management during dialysis. Reported for the month 90951 through 90966, less than a full month of services 90967 through 90970 per day. Codes divided on age and number of visits. So we're going to talk about hemodialysis. What is the function of hemodialysis? It's to route blood outside of the body for filtration of waste products. Hemodialysis is the procedure used for end-stage renal disease or non-end-stage renal disease. Billed per day for inpatients receiving ESRD plus non-ESRD. Includes all physician E&M services related to that procedure. You're going to use a modifier 25 if there's a separate E&M service provided. How long does a patient suffering from end-stage renal disease need to be on dialysis? Forever, or until he or she can have a kidney transplant. So miscellaneous dialysis procedures are 90945 through 90947. For example, peritoneal dialysis, in which toxins are passively absorbed into dialysis fluid. You would find that in this section of codes. Perinatal dialysis uses the peritoneal cavity. I'm going to read that again. Peritoneal dialysis uses the peritoneal cavity as a filter. Peritoneal dialysis is a continuous renal replacement therapy. Okay, peritoneal dialysis is reported monthly or if less than a month for each day the service is provided. So here is an example of peritoneal dialysis. Goes through the abdomen. So next we're going to talk about dialysis training. Okay, so patients can receive training in self-dialysis, and it's reported with code 90989 or 90993. Codes divided on complete or partial training program. Most third-party payers allow training to be billed for one time only. Okay, so next we're going to do gastroenterology 91013 through 91299. I didn't click my little thing to get all the information up for y'all. Sorry about that. It's for tests and treatments of the esophagus, stomach, and intestine. Codes usually reported with an E&M code or a consultation service code. Caution, many bundled services. Several intubation codes are listed in the gastroenterology subsection. Coders must carefully review the code descriptions to determine which services are bundled into the code. So again, you need to read your notes. Ophthalmology 92002 through 92499. Okay, so next, it is important to note that the difference between intermediate and comprehensive as it pertains to this subsection. Extensive subsection notes explains levels of service and present examples to clarify the codes. Codes are based on whether the patient is new or established and on the complexity of the service received. Now, there are definitions in your CPT that give you detailed definitions of intermediate and comprehensive services. So when you guys are looking at your CPT, you need to look underneath that section and you need to highlight those notes. Okay, ophthalmology 92002 through 92499. Example, intermediate is a review of history, external examination, that's scopy, okay, I'm going to skip that one. You guys see it there. The biomicroscopy for an acute complicated condition, for example, iritis, not requiring comprehensive ophthalmological services. Intermediate and comprehensive ophthalmological services constitute integrated services in which medical decision-making cannot be separated from the examining techniques used. So for example, they have to actually do the services, the procedures in order to come up with diagnoses or how they need to further the treatment plan. Okay, do you guys see that word? Special otorhinolaryngolic services. I'm not going to say that word again. 92502 through 92700 for special evaluation of audiologic system. It goes beyond the usual provided in an evaluation and may be reported in addition to basic audiological services. The services in this subsection deal with special testing or studies for the ears, nose, and larynx. Who can perform an audiology test? A physician or trained audiologist. Otorhinolaryngolic services. See, I said I wasn't going to say it again, but I did. Diagnostic and treatment services are usually reported using codes from the surgery section. Only special services are reported using the codes from the medicine section. All hearing tests bilateral unless indicated one ear in the description. You're going to use modifier 52 for one ear, which means reduced services. Okay, we're going to be talking about coronary therapeutic services and procedures. So PTCA 92920 through 92921. I am going to tell you what PTCA stands for. It's a percutaneous transluminal coronary angioplasty. You access through the femoral brachial artery and the catheter with the balloon tip threaded up to the heart. The balloon is expanded and widens the vessel. If an angioplasty and an atherectomy are performed during the same session, only build the atherectomy. If a stent is placed in a coronary vessel, the stent placement takes precedence over the atherectomy. Stent placements include coronary angioplasty when performed. It's going to be a 92928 or a 92929. Cardiography. Echocardiograms are ultrasounds of the heart that aid in diagnosing valvular disorders. The echocardiograms are selected by either complete exam or follow-up limited study. When coding for a full echocardiogram by a physician, you use code 93306. It shows the complete echo. Implantable, insertable, or wearable cardiac device evaluations are 93264, 93279 through 93299. And echocardiography, 93303 through 93355. Okay, and this is going to be our last slide for today. Cardiac catheterization is a diagnostic procedure that includes the introduction, positioning, and repositioning of the catheter to aid the diagnosis of the heart. Also included is recording of pressures, obtaining blood samples, and cardiac output measures. The first component of coding heart catheterization is the positioning of the catheter. Code selection is made based on where the catheter will be placed. LHC, left heart cath, RHC, right heart cath, BHC, bilateral heart cath. The second component is the injections. These are coded by what vessel is being injected. Last is the imaging. There are only two codes. Read the description carefully. So congenital cardiac catheterization codes are 93530 through 93533. Do not include injection or imaging. And a lot of this was reviewed in chapter 17. Okay, so that is going to complete our slides for today. You have another set coming. And these are going to be put on, let me look, where's my notebook, guys, with your stuff on it? Hang on. Sorry about being organized. Okay, so yes, these will be on for Wednesday. So I'll put the rest of these on for Thursday. Guys, have a great afternoon. Talk to you soon. Bye-bye.